So our next presenter will be Stace Maples. And Stace doesn't need much of an introduction to this team. He's the interim head of the Rumsey Map Center, for which we're very grateful. He's also head of the Geospatial Center here at Stanford. He has degrees in archaeology and geographic information systems. He works widely in teaching GIS here at Stanford with his colleagues, and also in working in the field in GIS and public health in particular of late. So Stace, over to you.
All right. Thank you, David. Thank you to the whole team who's assembled here and to everyone online as well. I will, to everyone's surprise and relief, keep my remarks this morning brief. And a couple of people are laughing because they know what that means. For me, that's an effort. But what I want to talk about is a little bit beyond what you'll see in the demos today. And I think the demos really kind of speak for themselves. And let's go ahead and let's bring this up. Let's hopefully. Excellent. So why machines reading maps matters. Obviously, for searching collections, if you're interested in historical cartography, if you're interested in the history of place, if you're interested in toponyms, you know, the value that this adds to a collection that has been digitized and made accessible digitally is massive and obvious. But I want to talk about two things that I think are important to consider right now. One of those is the IIIF Maps community, which has been active for about 3 years now. And we sort of have a critical mass of infrastructure that we've developed out of this community over the last 3 years. And two pieces of infrastructure in particular, I think, are important to consider in as we begin to discuss how we will move machines reading maps from a project to infrastructure. I was trying to explain to my wife what that means last night, and it occurred to me that a good analogy is if you're driving through West Texas and you see those oil pumps that are working, they look like birds dipping their beaks into the ground. That's the project, right? It's this singular thing, and it's working independently, and it has results. But then if you drive through Southwest Louisiana and you drive through refinery country, you see these massive complex of pipe work and tanks and storage. And that's really where we need to head with this. We need to make this infrastructure. We need to insert what machines reading maps is doing into what we do as digital humanists, as librarians who are providing digital and computational services on our collections as data. Two of the projects that machines are in IIIF Maps have been working on for the last year are really important to this effort, I think. One of those is the nav place extension, which makes it possible now to ship with IIIF manifests and content geographies associated with those objects. That is, we can ship GeoJSON now with IIIF. It's part of the specification. And this is an example put together by one of our technical co-chairs, Michael Appleby from Yale University, and just demonstrates how we can visualize collections using map data that's associated with those collections, whether it is the place depicted, the publication location, the bounding box of maps, or the locations of annotations. Lately, we've been working on georeferencing infrastructure, and the georeferencing extension has been approved. We're working on cookbook recipes now and examples of how to make use of this. What you're seeing right now is the All Maps viewer, which allows you, the extension essentially allows you to take a raw IIIF endpoint of a scanned map, nothing more than a IIIF endpoint of a scanned map, and georeference that map without having access to the server infrastructure. We can store the data required to warp those IIIF tiles on the fly in a JSON file, which is far superior to other solutions for online georeferencing in that we don't have to hold a copy of the image. We don't have to create a derivative TIFF. We can do all of this on the fly. And there's also, we've had Bert Span has designed a IIIF shim that goes from the warped IIIF tiles to XYZ tile services, which means we can eat it anywhere. We can use it in a GIS application. We can bring it into ArcGIS Online, or we can access those tiles to use them as image chips, for instance. But here's where this is where I really think the value in this project is. As David mentioned, I work a lot in public health. And one of the first projects I worked on when I got here at Stanford was a project to track cholera outbreaks in Bangladesh. And that's a difficult thing to do. The project was actually to create a piece of software that allowed doctors in low resource clinics to track patients through an outbreak. And one of the bottlenecks in this part of the world when there is a cholera outbreak is just the task of tracking hundreds of patients a day. If you only have a doctor and maybe 5 or 6 nurses at your disposal. That's really where the mortality comes from, is not being able to track patients properly. And so we built a piece of software that helped make clinical decisions about treating cholera, helped track the treatment process of patients through from their intake to leaving the clinic. And my part of the project was to map the cholera outbreak, to create an interface in the software that allowed us to let people tell us where they actually live. And so our initial design had a map in the software, and it failed beautifully. And the reason it failed beautifully is because nobody could find themselves where they lived on the map. And there's a really good reason for that. We had to revert to a set of drop-down menus, which is what you see on the right, because everybody gets taxed based upon the village, union, upazila, and district that they live in. And so everybody knows that hierarchy of where they live, it's sort of gazetteer-like hierarchy. And so we reverted to that, and it worked beautifully. But if you want to map these outbreaks at the local level, that's problematic, because one of the things that we discovered was we were given that hierarchy was actually from the Ministry of Health in Bangladesh. We were given a list of 90,000 villages in Bangladesh. And the best data set that we had access to that had the actual spatial data associated with those village names had 35,000 villages. So 2/3 of the villages that were in the database that we were trying to use to map these cholera outbreaks at the local level just didn't exist. The spatial data did not exist. And the problem, and that makes it difficult to map at the local level. So we were stuck with mapping at the sub-district level, which is the equivalent of sort of a county. And that is not high enough precision for tracking epidemiological events of this sort. And this last slide that I have illustrates what the problem is. So this is a view of the best data that we have on where people live in South Asia. And those of us who work in map collections probably instinctively know what we're seeing here. That patchwork pattern that you see is the result of the fact that the data that we have digitally is derived from paper map sources. It's derived from topographic series maps. And all of the areas that you see that are sparsely populated with populated place names are those places are either have not had the available maps digitized, or they are maps that were at a low scale, a small scale, right? And so the problem for us is that all of the data about where people live at the local level is trapped in paper topographic map collections, modern topographic collections, collections that were created in the last 40 to 50 years. Not the maps that we will see today and the maps that we're demonstrating this fantastic technology with, but the maps that are sitting in drawers up in the Brenner Earth Sciences Library and in other collections like the National Geospatial Intelligence Agency's collections, the Library of Congress collections. And this is where Machines Reading Maps as a project has really powerful potential to make an impact in locating and completing the map of where people actually live in the world, and completing this data set, making this data set comparable across the map, rather than having, you know, this sort of differential coverage of where people live at the local level. So I think Katie can speak to that next. The question is, have we begun to think about this idea of fuzzy search across languages? If someone is searching for instance, the term hospital or clinic in the search, how do we search across all of our collections, including those maps that are in Cyrillic or in Arabic script or printed in Chinese or in Japanese? And those are problems that are currently being addressed by the team, and we'll hear more about that this afternoon.
Thank you, Stace, and thank you, Mike, for that question. It's excellent, but we definitely are. Version 3 is the third version of the index. The index keeps getting updated as we get better, and version 3 will have a lot more languages in it, specifically the ones you mentioned. So I think that'll be exciting. And Stace, thanks for pointing out that this really doesn't apply just to historical maps. This can be of immense value for modern mapping. And I expect as we move through this, we may even be moving away from maps to views, you know, to other ways of looking at the world that also have a lot of text on them.